There I go. Hey, everybody.
Hi guys.
Hey,
Hello.
what's up, Kathy? Hey, Eric, you had to take my screen.
Sure. Just stop sharing. I gotta bring it up in a second. How you doing, Kathy? Are you in Louisiana today?
No, Las Vegas. I'm back.
Oh,
But
okay.
I'll be in North Carolina on Thursday.
Oh, okay.
So yeah.
Okay.
How baby boy doing? He ain't hit me up.
He's doing good. He's with Kaylani, so you know how that goes.
Enough said.
Yeah. Yeah, he's in Mississippi. I just talked to him yesterday. I mean today, but I saw him last week. We had dinner. And so I saw him one time and then he went back to Mississippi.
Okay.
Yeah. But he's doing pretty good. He passed his exam and he have his rotations.
Okay, nice.
Yeah.
Okay. Hey, Eric, you need me
So
to stop sharing?
I'm sorry.
Yeah. Yeah. Go ahead. And stop sharing real quick.
All right.
What up,
Yeah,
Walt?
he said
What
he
up?
liked it in Mississippi, which is kind of weird, but he's interesting.
uh,
I'll be right back.
hmm. All right. I need to switch off of this so you can pull it up, Eric.
Yeah. Go ahead and log out. I mean, you can
I,
pull off. Wonder where Coy is. Hmm. Hey, Erica. Okay. Did Derek just log out altogether? Why everybody disappeared? Oh, like Derek, where did you go?
you told me to come out so you can get in it.
I didn't think you were doing that. My bad. Oh. You want to check see what Coy is?
He said he running behind.
So really quick, I will have to
I
take
do.
a call at 5:45. Well, it's more like 5:50, but just so you guys know
Oh, it's all good.
that I'm not escaping you.
Don't worry, Erica picking on me right now. She's like, every time you come on, you act like you don't know what you're doing. Erica, I really don't. I really don't. I'm just figuring it out. Just keep swimming. Just keep swimming.
Really?
Yeah.
All right, Dora.
That hey, it is what it is. Okay. So let me share this. There we go. Okay, so we're going to be talking about mental health awareness. This time we're going to dive a little deeper into anxiety and things of that nature. You got to forgive me, my kids are still up too. So you're going to hear some craziness like before. We're going to dive deep into this part here. When it comes to that, depressive disorders, but we'll also talk about food disorders or things that dive in, so things that cause you to eat more or something of that nature, and how that actually affects metabolic disorders and things of that nature. So we're going to dive a little bit into that as well. So with this part, Kathy, you want to talk about this depressive disorders? Explain exactly what exactly are depressive disorders?
All right, Kathy, are you on mute?
Can you
Yes,
hear me now?
yes, there you go.
Okay, I'm over here like da, 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 da. Okay, take two. All right, so depressive disorders can come in a variety of things such as anxiety, depression. You can have premenstrual depressive disorder. You can have, let's see, gosh, Major depressive disorder, did I say that one already? No, I don't think so. Those are a few things in regards to depression. However, there are other disorders that can look like that, such as bipolar. So you have bipolar 1 and 2. Bipolar 1 and 2 are not depressive disorders, they're mood disorders. So that's when people say they have the mood swing. Bipolar 1 and 2 with major depressive disorder. So it's a little bit different. What and how we are able to diagnose a individual is basically by the DSM-5. And so there are certain stipulations that you have to follow in order to meet that criteria. If you meet the criteria, then it is considered a mood disorder, which you will hear bipolar 1 or bipolar 2. If it is not, then more than likely the patient have anxiety or depression. So those are just a few things. I can dwell deeper into it, but that's like the gist of it.
Okay, so one thing that's very interesting, because as you notice, everybody's talking about mental health, and that's one thing we want to focus on, and we're going to hit the food aspect of it too when Dr. Coy gets on. Now, I know you can't give us client details, but statistically wise, have you noticed an upkeep or uptake or uptick, I should say, in the amount of people you're dealing with or clients you're dealing with when it comes to just anxiety and depression, or is it more anxiety or is it more depression? How does that work?
I can't give you a number. However, I can give you examples without disclosing HIPAA information or going against that. So for example, this week I had a patient who was diagnosed with bipolar 1 with major depressive disorder. However, she was diagnosed initially by a provider who said that she had anxiety, which was generalized anxiety disorder. So anxiety can range from generalized anxiety, or you can have adjustment disorder with anxiety. You can have anxiety disorder, mood disorder. Wait a minute. Adjustment mood disorder with anxiety and depression, and that is considered mixed. So this patient was initially diagnosed incorrectly. She was diagnosed with anxiety and depression. So the symptoms that she was describing was basically related to patients who have bipolar, but she was on a different medication and she complained constantly like this medication is not working, it's not working. They've tried several of them. And I've been seeing that a lot. As a matter of fact, in the last 2 weeks, I've had 2 patients misdiagnosed with bipolar when they only had anxiety and vice versa. So like I said, I don't have a percentage, but I will tell you since the pandemic, there have been a lot of individuals who have started complaining of anxiety, depression, and not only that, but ADHD. And they figured out that they had these disorders because they were pretty much stuck in the house. So, yeah.
Okay. Well, when you mentioned ADHD, explain that. And is that related to, because this is part I don't even know. Is that somehow related to some of the depressive disorders, or is that its own entity?
Absolutely. So ADHD, attention deficit hyperactivity disorder, or people used to say back in the day, oh, they have ADD, which is attention deficit disorder. So you're more on the slower side. But the hyperactivity disorder is more hyper. So how does that play into mental health? It is a mental health condition based on the DSM-5. But the reason why it is so important is because patients can exhibit symptoms of depression and anxiety because a patient who have ADHD, they may be hyper or they may be sad because they're not getting their work accomplished. May sit at the desk or get up 5 minutes, go wash, do some laundry, come back, and they're still not anywhere near accomplished as they would like to be. So then they start to present with symptoms of depression. So the reason why ADHD is so important to figure out whether they have that versus anxiety or depression is because of the medication that we have to treat them with. A patient can have anxiety, depression, and ADHD, or they can have just ADHD. But if you give a patient, say, for example, if a doctor were to say, oh, yeah, you have anxiety, you have depression, because what they're going by is the GAD-7, which is for generalized anxiety disorders, the screening tool, or you have PHQ-9, which is your depression screening tool. So if you have a higher number in those screening tools, a doctor may say, oh, you have depression, anxiety, when in reality, they didn't go deeper to understand, okay, they don't have that. They have symptoms of that, but they actually have ADHD. So if you treat that patient with an antidepressant or a anxiolytic, anti-anxiolytic, it's not going to work because it's not working for the correct diagnoses. If you have a patient that have ADHD and you try to give them a antidepressant or a anti-anxiolytic, it's not going to work. However, if you swap it and you give that patient a stimulant or a non-stimulant but have the same effects of the medication, for the diagnoses, then it will work. So it has a lot to do with a lot of the diagnoses, not just anxiety, depression, but also bipolar, because if you dig deeper into it, you'll actually see a lot of the similarities, as well as hyperthyroidism. So I always go back to the thyroid because if you look online, you Google what are the symptoms of hyperthyroidism, it has depression, anxiety, all of those kind of things. So they're often misdiagnosed, often overlooked. All of that plays a part. Sometimes they can be super hyper, so the person may say, oh, I think they have ADHD. And the whole time, this patient has hyperthyroidism. So all of that plays a role. It's all about how we take the time to actually listen. And if we listen to our patients and not just listen, also take their cultural aspect into consideration. And the reason why is it's not all about white and black, or if they're from Africa or what have you. Sometimes when we explain things to our providers, and if they're not someone that look like us, then they may misinterpret or misdiagnose based on what they think we should have. And I can go deeper into that. I have all year. But yeah. So everything kind of ties together. It may not make sense initially unless you actually have, like, say, for example, the Vanderbilt screening tool, which is used for adolescents, children and adolescents. And that's the screening tool for teachers and parents to complete. However, the ASRS is for adults, which some people may say, oh my gosh, I hit 40 years old and I'm in school and I can't even concentrate. It's because all of their life they've been pumping soda, Pepsi, Coke, or either espresso constantly inside of their body to function, which is nothing but a stimulant. And only to find out that they actually had ADHD the entire time, but was never diagnosed.
Gotcha. Now you said one thing that I thought was pretty neat, and well, no, I can't even say neat, but we do kind of relate to it. Is that it's always the color of your skin, and people think that okay, if you're black, you have higher levels of depression versus your white counterparts because the whites they have more money, the socioeconomic status is better. But then what you're really taking into consideration is your environmental status. Your environmental status in general does play a significant role in it. but not just your environmental, your job, what type of job you have, your high stress jobs. I know
Exactly.
the next slide we get to it is start talking about that, but people do have to take that in consideration as that your jobs, different jobs will definitely affect you from that standpoint. Now, for you, what do you see as what affects people more when it comes to a job? Is it particular jobs you see, or is it particular jobs that you see as more stressful than others, or particular jobs that causes more depression than other jobs?
I'm going to give it to you from both angles because I've had white patients as well as Black patients actually work for Apple. And the white counterparts are just anxious. They just want to hurry up and get it done. So they're having a bunch of anxiety or the need to overperform in regards to accomplishing the task on time. So a lot of them want some Concerta or Adderall for ADHD. So they have the anxiety and the ADHD. However, I've seen a African American work for Apple, and their diagnoses and their symptoms are kind of similar, but they're expecting that African American to work super hard to overperform. So they're having anxiety, they're having depression, and feeling the need to overperform. Um, I have seen some veterans that are either retired or some are actually um, still active duty. And those individuals, it depends on, like, I had what do you call it? A load master. So they were line side. And then I had a medical professional. Both of those individuals had high stress levels versus this one guy. He was a retired, he worked for DOJ in DC, and he actually relocated here to Vegas. He did not have a stressful job. He had a great job, but he has so much anxiety as to, oh my gosh, I no longer have a job. What am I going to do? Am I going to die? Am I getting older? Like, what does this look like? So it just all depends. And he came from a very good, socioeconomical background versus someone who may not have, but he's worried about, I mean, I'm not going to say it's simple things because I don't want to downplay that. But hey, if I don't have to work and I'm still making money, I'm just going to be chilling. Hey, I'll be a Walmart greeter. But some people stress over other things, and I don't know what to say about that. But I don't want to dismiss their level of stress, while trying to take it into consideration. So
I'm with you. Yeah. Now I'm just curious now from what you see and more from what I see when we talk about, let's relate the depression and food, or actually food and mental health. So from me, I can see a lot of the processed foods, um, stuff that is not natural. It actually affects you more in a negative aspect because of the chemicals that are in your body, and more than likely, and I can't really break it down from a neurological standpoint, but I'm pretty sure that is affecting you mentally, where it's affecting not just your emotional state, but let's say how your body responds during stressful situations. And
mhm.
from what you've seen, because I have never done a study on it, but let's say you have a person who eats a lot of processed foods, your processed sugars. Have you seen it where they have a higher level of depression versus somebody that eats more natural?
Absolutely. And I've also seen a higher level of autism. And so patients who have eaten a lot of processed foods and may have either been on the spectrum with autism, or either they're not reacting well with the medication, they change their diet. With depression, yes, you mentioned something great when you said, okay, they're eating a lot of bad foods, things like that. But, and it's not really natural. However, they can take supplements, and people are getting into this whole holistic medicine, this whole holistic care, when they're not realizing there's certain over-the-counter herbal medications that can also work as antidepressants. So you talk about neurologically, if you put all of that in your mind, and it's like medication topping. If you take too much Benadryl, right?
Mm-hmm.
Benadryl is going to work great for the first night, whether it's for allergies or to help you sleep. But then if you say, okay, well, I had 25 milligrams, that worked well, I like how I felt. Then tomorrow you take 50 milligrams and it's in your head. That's, eventually all of that medication is an antihistamine, but it can also affect like your dopaminergic receptors.
Mm-hmm.
Causing some issues, causing you to feel like you're more depressed, or it can actually cause some psychosis too. So it's not just the bad foods that we're eating, but it's also a lot of the over-the-counter medications that we think are great for us. Or you can get it at like the herbal store. They're not great. Not all the time. And it depends on how we use them, which will make them either great or it's almost like overuse, over abuse type thing.
Okay. Well, let's take it back to this way then. When you mentioned, I'm going blank because can't even figure out what you really. I'm sorry. The record's 12
Somebody
shots.
said Benadryl 12 shots.
Holy crap! I'm good on that. But okay, so let's look at poverty then, because I know that's on the slide. Poverty and processed foods, because you're looking at poverty. People are not able to afford more of your all natural foods. You're doing more processed foods. From your standpoint, because my background is really not with a lot of the civilian population, but from your background, have you seen more of the impoverished with more of your mental health issues, or because of their diet, or you haven't really seen much of that?
Not really because of their diet. I have seen quite a few because of the drugs that they've taken. And believe it or not, it's not marijuana. It is other things like meth and coke and huffing. That's where I've seen the issues. But I haven't really seen a lot of patients have a lot of mental health diagnoses, especially anxiety, depression, relating to the things that they're eating. Most of the time, it is the medications that they're taking. They just counteract and cause other symptoms.
Okay.
Now you can have a bunch of anxiety and depression if you're living like and I can't even say Section 8 housing, but how about like living in subsidized housing, and your check just got decreased or your food stamps just got decreased? That's enough to stress you out. It may not even have anything to do with the food per se, but just everything that they're having to encounter in their life and having to load onto their plate. But I've also seen this, and this is why we can't necessarily say where they live. That does play a huge role. But I've seen some wealthy clients, the ones who actually have to pay a copay, they're having it the worst. Then they're having it worse off than these clients who have Medicaid and don't have a copay, don't have a care in the world. They're just like, hey, I want to get my medication or my mental health checked or so on and so forth. It's mainly the people who can't afford stuff that have a lot of issues.
Okay. I'm with you on that.
Okay, so one question. I know y'all were talking about anxiety, and that's one thing I'm trying to understand, especially with my students, because a lot of them do have that anxiety. So when it comes to this, I know right here in the slide it's talking about they're characterized by persistent excessive worrying or fear that can significantly interfere with daily life, include conditions like generalized anxiety disorder and so forth, which everybody can read, so I'm not going to read the whole thing. So my question, when it comes to that, you have different ones. You have social anxiety and social phobia. Now, social anxiety, is that similar to like introvert? Because I don't have social anxiety. I just don't like to be around a lot of people sometimes. So I was just wondering.
Just me.
Oh, that's just me.
So yeah, it's social anxiety. If you hear people that say, "Oh my gosh, my social battery is going dead," like I'm drained. Somebody you could have gone to Fremont Street, right? And as soon as you walk up to see about 4 people, you're like, "Yep, I'm over this." That's more like social anxiety. It could be you having to do public speaking. You don't enjoy that. You may enjoy speaking, but just not to people that you don't understand or don't know. Um, Social anxiety can be just like some of these celebrities, such as Mary J. Blige. That's why she used to do coke and drink all the time, because she had social anxiety when it came to singing on stage in front of people. Now she's able to work through that and get through it. Social phobia, more so, is like, oh my gosh, I think it's going to be like, okay, if they're afraid to um, be around a clown, for example. Okay, well, if I go to Fremont Street, I may see that clown, so I don't want to go over there anymore. And they start freaking out, so they turn around and don't want to do anything. Can you go back to that other slide for me? Yeah. So with the social anxiety, it it is the need, like the people have issues because it is the need for them to perform, and they don't want to look weird in front of somebody. So then they start, sweating or stressing out or stuttering, or some people just cry, or um, freeze up. They may speak and then their mouth is all of a sudden dry. So that's why a lot of people speak and chew gum at the same time, because they do have that anxiety level. And another thing that can come with social anxiety is neurocardiogenic vasovagal. So if you get too stressed and too anxious, then your blood pressure will go down while your heart rate goes up, and then boom, you pass out on the floor. So it can be that bad. That's why they prescribe beta blockers for that purpose, just so people's heart rate can stay stabilized. Normally, anywhere between 70 to 100. Anything under that or over that is considered abnormal. With the other anxiety disorders, it can be, let's say, so generalized is a lot of things under that umbrella. You can have like 5 different things. Okay, I don't like to be in the car driving in the left lane because I know the people in DC are going to go super fast. But some people may be like, oh my gosh, who is in the right lane, because that's making me panic. It's making me like go crazy. However, you can also have what is considered like anxiety of a object, and anxiety of, like, let's see, being at a high level. So you're afraid of heights. That can be anxiety. But you can also have an adjustment disorder, which I was talking about earlier, that is a different level of anxiety, because adjustment disorders can be mixed, or they can be adjustment disorder with anxiety, or then it can be adjustment disorder with depression, or it could be both. The reason why that's so significant, set aside from generalized anxiety disorder, is because if you need to get a job or something like that, say if you're a nurse or you're a doctor, or let's just say a medical personnel, if you're trying to get licensed for certain things, they ask you on the application, do you have or have you ever had any mental health diagnoses? Generalized anxiety disorder is considered one. However, adjustment mood disorder is more like, oh my gosh, I'm having to relocate from North Carolina to Las Vegas, and you're having to deal with that acute issue versus something more long time, more permanent, that you've had to deal with pretty much all of your life. The adjustment disorder can be fixed, but the other one is you're kind of stuck with it, honestly.
Okay.
So one thing is very unique when you were talking about how Mary J. Blige, things like that, is unique, or for me, it's amazing that you have all these singers and they suffer from anxiety. And
Mhm.
it's like y'all perform in these large crowds with thousands and thousands of people, but you suffer from anxiety. So that's very interesting. I forgot one of the guys in particular, and that's one of the things, he has a nervous twitch that goes with it. And when his anxiety, I know I've seen a video clip of when his anxiety flared up, the crowd sung with him and it helped him out. So it's
I
interesting that
think I know what you're talking about.
I don't even know the singer
I
name,
think
but
he had Tourette's.
yeah, okay, Tourette's. Okay.
Yeah, but I think he had anxiety as well. And
Hmm.
so when he got super nervous, his Tourette's got worse. But
Yes.
if he'll, have like the tics and the Tourette twitches and things like that.
Hmm.
And like the crowd knew that he had this diagnosis. So that's when they would start singing loud with him and it'll allow him to relax. But like with the singers, you can sing your heart out, right? But are you going to sing better when you have some liquid courage? Absolutely. You're going to sing without fear. And that's why people do karaoke and they, throwing back like 4 and 5 because they don't have that fear of, oh my gosh, this person is looking at me or they're laughing at me or they're not going to think I sing well. But if you go in there sober and you have that anxiety, you're always going to think, oh my gosh, they don't think I sound good when you can be blowing through the roof. So it just depends on what people are going through. And some people just don't know, like they have these diagnoses and stuff. So they go through life not knowing how to perform or do
Hmm.
well with it. I mean, even professors, one of my patients is a professor and they have to take medication because it's something about when they get in front of the classroom, they do not do well. They're sweating, I mean, bullets. So they have like a breakthrough anxiety medication that's not addicting and also a beta blocker to help them. But once they're like writing reports and checking grades, they're like, oh, I got this. So it just depends on whether you're in front of somebody or not.
Okay. So this right here, because it's talking about generalized anxiety disorder, and honestly, I've never heard of. I just known anxiety as anxiety. That's the
Mm-hmm.
way we've always dealt with it. And talking about non-specific anxiety and fear, one thing unique is that very last bullet. For a diagnosis, it must last at least 6 months and interfere with daily functioning. Why?
Yes.
Why is that? Why does it have to be 6 months? Why can't it be just 2 to 3 months? I mean, where did the 6 months come to play?
So whoever wrote the DSM-5 with psychiatry, they said if you have generalized anxiety disorder, in order to appropriately diagnose that patient with that, then you have to have it for a long period of time. So if they just have like an anxiety moment,
Hmm.
such as a shooting, and they're like, oh my gosh, I'm anxious. Well, how long have you had that? Oh, I've only felt like that for 2 weeks and then it went away and I never felt that before. So that would be more like the adjustment mood. Because if you diagnose them with generalized anxiety disorder and they've only had it for 2 weeks, you just misdiagnosed that patient. The reason why that is so important is because there are medications that are approved by the FDA specifically for anxiety, specifically for generalized anxiety disorder. So there is a difference and you can't necessarily treat all anxieties with the same anxiolytic because they don't do the same job. They don't hit the same neurotransmitter. So it all plays into a different role, and you have to have an understanding of like your neurotransmitters, which one is affected, which one is not. Like, for example, the fight or flight. That's norepinephrine. We have to remember exactly what we're dealing with in order to know how to treat it. So with the DSM-5, if you've had those symptoms 6 months or more, then that would be your diagnosis. It just simply helps narrow it down. But if you just go like, oh, they have anxiety, well, what kind of anxiety? It's a lot of anxieties out there. So it's best to understand and ask all of these questions, which is often skipped because nobody want to pull out that big book to say, hey, well, it's like 20 questions you have to ask. Okay, well, if it's not this one, then it's this one. If it's not that, it's that. It's a lot under generalized anxiety disorder. So that's why they do it. Otherwise, you will misdiagnose that patient and wonder why the medication is not working.
Right here, Jovan says, seriously, has there been any studies on medication anxiety? Now, Jovan, quick question for that. When you say
Meditation anxiety?
medication, meditate. Oh, I thought I said
No, I'm like, wait a
medication.
minute.
My bad. You're right. I can't even read tonight. Meditation anxiety. So it's a bit any study. So that makes sense because I know they give you the different hints, say relax or different types of meditation. We talked about that last live. So what about this with meditation and anxiety? Do you suggest this for your clients?
Absolutely. Absolutely. I definitely support that. There are plenty of articles out there that discuss meditation with anxiety, with depression, with a lot of disorders. Um, and what I usually like to, I mean, I'm not going to say, hey, go out there and buy the Peloton app, but I have the bike and the treadmill, so I have the app on my phone. Every day I do a episode of meditation when I wake up. Well, I pray, then do the meditation for either 5-10 minutes, and you should meditate before you go to sleep. It helps relax your mind. It helps clear your mind. So is pretty much like having peace within yourself. And like I said, that's for anxiety and depression.
All right. Here it says any correlation between anxiety disorders, panic attacks, and or triggers for attacks. So I figured if you have panic attacks or you have anxiety, I guess there'll be triggers or things. Is that actually true?
Oh, absolutely. Okay. 100%. So I'm going to use something as simple as relationships, a boyfriend, girlfriend, right? Mm-hmm. They've been, I'm old school, so they've been going together for a while, right? And this guy has been cheating on her, and or let's say the female, one of the individuals have been cheating on the other for the last year, and they start arguing all the time. They break up, then that person no longer has the stress level that they used to have. They get back together, and there is the trigger. They start arguing again, and there goes your depression, your anxiety. So when they talk about triggers, they're trying to figure out what is causing you to feel like this. And with that being said, that's when you have to get down to the root of the problem to say, what is your issue? Why do you feel like this? When do you notice that you feel like this? Is it in the morning? Is it at night? Is it after you talk to a certain person? Or it could be after you eat certain things. Did you eat something and now you're like flying off the roof? I mean, I can have espresso number 4 or number 10, right? If I have number 10, I'm feeling anxious. Does that mean I have an anxiety disorder? No, but I just consumed a stimulant that has my heart pounding, and now I'm all jittery, feeling anxious. Or you drink 3 Pepsi Colas, it's the same way, you know? So it just depends. You can have different triggers, say like a dog. You see that big dog, and you were bitten by a dog when you were 3 years old, and you know that's your trigger. Every time you see a dog, you reflect back to, oh my gosh, that's when I was bit. That dog is going to bite me, when that dog probably is like a little fluffy baby and not even going to touch you. But that's your trigger. So you can either breathe and woosah and try to relax. You can do some EMDR treatment to help you get through the post-traumatic stress that you have had since you were 3 years old. Or you can take some medication, or you can do medication and all of the above. But holistically, I try to do holistic care first, rather than shoving a medication down a patient's throat. Some providers, they just want to treat them is treat them. The reason is because that's a moneymaker. That patient is going to come back. But I also feel like a patient will come back if they feel like I'm taking care of them, I'm listening to them, I'm treating them. And I tell my patients, sometimes holistic care is great, but you need a little bit more. Maybe Lisa can handle that, but you just can't. So it just depends on the individual, but anxiety triggers is a real thing. Big time. It's,
What up,
it's
Dr. Coy?
like deployment. I mean, if you hear some fireworks, that's why the people say, "Oh my gosh, they have PTSD." They jump on the ground. You know, the Vietnam vets, because it is a trigger. You hear that loud noise. You know.
Makes sense. Dr. Coy, I know you face this a lot when it comes to your clients, the anxiety, not the medication, but the anxiety, as well as dealing with the metabolic disorders. So, how do you handle that? We were talking about anxiety. Sorry about that.
No, that's fine. And you can hear me okay, right?
Yeah.
Yeah. So as far as one of the things that I look at is folks that come into my office, they're dealing with numerous health issues that the medical model, the traditional medical model, sometimes either fails them or they're not getting to the results that they're looking at. And even in that in itself is very depressing, right? And especially even with type 2 diabetes, which we see lots of type 2 diabetic patients that we help reverse their diabetes. And one of the things that we see is what's called diabetic distress. And that is when a patient has got diagnosed and they are either not paying close attention to their symptoms because it's troubling them. They don't go see the doctor as often as they should. They don't check their blood sugar. They don't monitor their progress. It can send them into this depressive mode. And, one of the things that I always try to deal with or try to do is make sure I educate them about their situation so that they are more empowered that, hey, they can do something about this. And believe it or not, as we go through the process of helping them reverse their type 2 diabetes or other chronic health conditions, autoimmune conditions, and things of that nature, I find that we have to address some deeply rooted mental health issues, with addressing their cortisol levels, their flight or fright response to things. We have to address their nutrition. We have to address those things because we have to look at all the pieces of the puzzle and not just, solely look at the symptom. And I will tell you, I'm not a mental health expert, but seeing this over and over again, in my scope, I have to help them to unroot some of those things and then either push them to the professional like Miss Catherine here. So, and then allow the professionals, the experts to form a team around them, around that particular patient to find the best solutions for them. And the results are very remarkable. You can tell when a person is really addressing their root issues versus someone that's masking or pushing it off, and they're dismissive and they're not really getting to the root of it. So there's a well-rounded approach to way I look at it.
Hi, Dr. Coy.
Hey, y'all didn't kick me off.
No, I told him to hold off on you. You didn't need any time, so just hold off.
Thank you.
No, we were just talking about mental health, anxiety disorders, and
Eric?
for you, I know that you face a lot of anxiety. Not you particular, but your clients face a lot of anxiety. So when they're coming in, that's one of the things they talk about is, hey, when it comes to type 2 diabetes, I'm dealing with this, but I'm stressed. And I know you were talking about the root cause.
Yep.
So when you say, how do you get to the root cause? Honestly, like, how do you get to the root cause?
Well, with type 2 diabetes is one of many metabolic issues. And again, I deal with autoimmune issues. And so a lot of these things kind of just intertwine and interlace with each other and overlap, like you said. But one of the things that we have to do is to look outside the box of what they've been told. Like many times patients will come in saying the same story of saying that, I don't feel well. And I've gone to this doctor, they put me on all these medications, and sometimes the medicine helps me a little bit, but then they don't work. and or they've run labs, but I find that their labs are not as extensive as they should be. And
Right.
so when they go home with a medication, it may work a little bit, it may not work, or they even may get worse. That in itself starts to help them spinning in a negative cycle with just being disenchanted with the whole system. And they go back, they're doing what they're quote unquote led to do, but it's not working. And a lot of times doctors are beating them up. They are telling them they're not doing what they're supposed to do. And it just, and that in itself creates this anxiety. This creates a depression
Mm-hmm.
when you're in that state. And a lot of times with patients, it's just, hey, just shut up, be a good patient, do what I say, but not really looking deeply. So getting to the root cause is doing more tests, doing tests that a lot of times are just missed and marginalized and
Exactly.
dismissed, so that and they're more valuable. And a lot of times patients are really asking for, hey, I need more tests, I don't feel well, this is not going
Right.
well. And so when we do those tests and we find these things that happen, we look at not only blood work, but when we look at anxiety, depression, and all
Yes.
these things, looking at their hormone panel, like
Exactly.
looking deeply at their sex hormones, their stress hormones, their immune system, all of these factors, these are all keys. And then you start putting the puzzle pieces together to
Mm-hmm.
make this puzzle come together the way it should. And so, um, it's really, really, it's heartwarming, because when you see a person that has been led down a path to an inevitable end,
Right.
and seeing them that they didn't take no for an answer,
Mm-hmm.
and they said yes to looking at it in a different light, taking a different approach, and then really investing in their health, and seeing that they put everything in place, things start turning around, results start happening. Nobody wants to lose, nobody wants to
Right.
feel bad. So it's good to see how patients really reverse their issues by getting
Mm-hmm.
tested and putting the plan in place.
And Dr. Coy, you mentioned something. You said the cortisol, right, for
Yeah.
the stress.
Yeah.
So with the normal panel, they
Mhm.
usually do your basic metabolic panel
Mhm.
and your CBC for your complete blood count.
Mhm.
But they don't always run a thyroid panel. They don't
Mhm.
always run your cortisol level. So
Mhm.
if that patient is constantly saying they're stressed, or they don't feel well, and their cortisol level is through the roof,
Yeah.
then again, that's probably why a medication is not working, or you have to figure out why that cortisol level is that high. It's not
Right.
just because they have high blood pressure or something like that. They have some other things going on,
Right.
and sometimes we internalize things because we don't want to tell the truth
Right.
about, well, the whole truth, you know and so we could be missing something great when we could have resolved it a long time ago had we known everything. But a
Right.
lot of providers don't necessarily just say, hey, I'm going to do a cortisol level on you, just right out.
Mhm. Well, let me share my screen for a second. Let me see. Am I able to?
Yep, you should be. It say present at the bottom.
Yeah.
Erica picked on me last time, so she talking about every time I get on here, I don't know what I'm doing. I act like I don't know what I'm doing. I'm like, because I don't.
So you can see this, right? Can you see this screen?
Yep, there you go.
Yes.
Cool, cool, cool. So one of the things with stress, we have to look at our adrenal glands. And adrenal glands are these two glands right on top of our kidneys, right up here.
Mm-hmm.
And 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 one of the things that I do is I test I do a saliva hormone testing. And this is a lab that I just did a master class about reversing type 2 diabetes and things of that nature. But this really bodes true for even a person that is dealing with depression and anxiety, because
Mm-hmm.
you want to see what's happening. So what this is a part of a adrenal stress hormone panel. So so this is cortisol right here. Cortisol is your flight or fright hormone. And one of the things that we do is we test cortisol in 4 different phases of their day. So we do an early morning AM, and we do a midday, a 4 to 5 o'clock, and then a late night. So if you look down here, this patient, this is a true patient here. I'm not disclosing their name or anything like that, but
Mm-hmm.
you see this total cortisol output. Do you see this 373?
Mm-hmm.
That is how much cortisol this patient is putting out of their adrenals, when this number shouldn't be higher than a 46.
Mm-hmm.
Is an extreme amount of cortisol all throughout the day. And you see this green shade right here. This is where
It is.
their normal circadian rhythm of cortisol, which is a flight or fright hormone that turns on the brain, that gets you
Mm-hmm.
going in the day, but it's supposed to descend as the day goes on. But you can see this person is through the roof. Like when you were just saying,
They're
you
on
know,
edge all day.
they're on edge all day, and they can't turn off. Like
Right.
I mean, no wonder. So when you were talking about energy drink, this is their natural energy drink right here.
Right.
They're through the roof. They're on edge. This is that anxiety. And then if you just turn this around and go the opposite way, where if this was extremely lower than these marks here, where they're riding low, it's almost like a flat line. You'll see a flat line that can be associated with adrenal hypofunction. That can be where the depression. That's where they're just not able to respond appropriately,
Right.
and no wonder why they all have type 2 diabetes or hypothyroidism or all these other factors that's going on. And so this is something that oftentimes is not covered by insurance.
Right.
And so if it's not covered by insurance,
So
then
you're not gonna run it.
why I'm going to run that? But this
Mm-hmm.
gives you valuable information, especially on how you can be able to treat that particular person. And it's amazing. We do the treatment, we do it in a holistic manner. We start looking at, hey, we need to do some counseling, or hey, we
Mm-hmm.
need to do heart math, meditation, prayer. But then we address the physical disconnections that are going on with that particular person, and you can see those circadian rhythms go down. You can see them resting better. You can see them responding appropriately. They want to be associated with society again, and family functions and all those things
Right.
that we all want to do. But
Not
these
stressed
are
out.
that's just an example of
Mm-hmm.
what we do to make sure we have that holistic approach.
So I got a question for all three of you all.
Sure.
So when it comes to that, because you're dealing with the clients all the time. So when it comes to that, how do you handle clients that are just high on edge with anxiety, but at the same time they're facing the depression, but at the same time it's like you tell them, hey, this is what you should do to help bring everything down, but they don't listen. Because I know for me that'd be frustrating as a personal trainer. I face that. It's like, yo, I'm getting frustrated, and I'm trying to help them out. But do you recommend? Hey, do you recommend going to mental health counsel or seek counseling, or how do you handle that? That again, that's for all three of you all. How do you handle that?
I personally, so you said, um, this is what I want you to do. Some people, they're not receptive to that. So they hear you, what they hear is, you're telling me what I'm going to do. You're not going to tell me what I'm going to do. So what you have to do is reverse psychology. Hey, so I see that you gained a lot of weight, and um, let's get in the gym, but these are some things you can do. What would you like to do? It's just like the military. You always have to make it seem like it's them, right? Oh, what would you like to do? It's their idea. When really you want them to do it, because otherwise they may end up dying. But you have to get their buy in. If you don't have their buy in, you're done. In order to do that, you have to build a rapport. If you don't build a rapport, nobody's going to listen. They're closed off. So you can't tell anybody, especially a non-compliant patient, what they will do, because they will not do it. It doesn't matter. Even if it's free, they will not do it.
Now, one thing, one thing you made me laugh was you like, for the military, hey, what would you?
It's the truth.
I'm in the Army. It's like, you gonna do it or you can, or not. You're gonna do it regardless.
Yeah.
You don't do it right now. You're gonna do it in 5 minutes, or we do a corrective action.
Right.
So
Again,
a little nicer.
The military, right? Okay, so we wear so many extra hats. We have collateral duties. So when I joined, they said, "Oh, what do you like to do?" Because it's best for you to choose something you like to do rather than be told what to do. So I said, "Oh, I'm going to volunteer to sing the national anthem because that's an activity I like to do and it's free TDY." Right? Okay, so I'm just going around to sing for fun versus doing some stuff that I don't want to do.
Oh no, we done lost her. She's coming back.
But that is a good point though. I think it goes back to ultimately for me the goals of that particular person. And when you define those goals, I mean, we talk about this a lot of times, is they got to be specific, they got to be measurable, they got to be realistic.
That's smart.
They have to be, the smart goals, right? And I just even had a patient today that I really had to, just try to get in her mindset about how to, as you're going through care, sometimes there's going to be these ups and downs. It's never just, we're going to get to the goal, A plus B equals C all the time. There's always these things. And I always have to tell patients that healing is not a linear situation. You're going to have some ups and downs with it. And you got to get them to understand that, okay, well, they may have to reassess their goals and do things that they don't really think that they need to do, but they need to put more attention to it. And if they're going through a negative cycle, and how you can tell how they're speaking, you can tell what they're focused on. My goal is to, all right, get them aware, make them aware of how they're speaking or how they're thinking, and really, have that time with them to say, okay, well, what do you think would be the best way to get yourself out of this situation? And another thing that I always like to say is, what would a healthier version of yourself say or do in this situation?
That's right.
And a lot of times they will come up with something that they should do. Now it's time to, okay, how are we able to put that in action? If that means that, hey, I had a patient today that said, you know what, we're revealing some things and I need to talk to somebody about this. If it becomes more their idea,
exactly,
then it's more likely, the likelihood of it going is, the success is going to be better than them not. And I think as professionals, as doctors, we have to, I think it's our duty to reveal those things. We may not be able to correct it right then, but call it out in a compassionate, empathetic way so that they receive it properly. And, hopefully you have a solution or have a direction to which they can go in and at least try and move them in a better position.
Exactly. They teach us that with motivational interviewing. When you have to say, if you have a patient that's on drugs and you want them to get off drugs, that they don't need to use it, but hey, do you want to do this or do you want to stay on drugs? Well, this is what it's going to look like if you stay on. This is what it, look like if you're off. So it's all in the same realm.
Right. And obviously, what is their why?
Exactly.
What is your why? And I think that's even for us, like, even as doctors, we have to go through our own mental health, struggles of managing things, of home life, but professional life as caregivers, it's very demanding. And hopefully we come back to, okay, well, why am I doing this? Why am I putting forth the
Exactly.
sacrifice, the time, the effort, the resources, to do this? There has to be something bigger or greater than yourself. And usually if that why isn't big enough, it was refreshing for even my own patient to tell me that, you know what, I got to go back and think about my why.
Yeah.
My why isn't big enough. Apparently it's not, because I thought that it was to reverse diabetes. That was my why. And I realized that, oh,
There is
there's
not.
there's stuff I got to do. There's all these
Mhm.
things I got to do. And yes, I'm not where I'm at, and I was depressed and anxious about labs and all these things. But you know what? In order for me to stay on track, I gotta have a bigger why so that I can keep it going and not quit on
Exactly.
myself. So
The short term goals first and then the long term.
right, right.
Yeah, I agree with everything you're saying. My only different approach would be is just acupuncture, and I say that from the standpoint. A lot of people, well, I won't say a lot. Some people are looking for alternative methods,
Right.
and with that, introducing the acupuncture, which is more of the traditional Chinese,
Mhm.
and they'll realize that some of the needling in certain specific spots will get them to calm down. It doesn't change their overall depression, uh,
But it
but
can't help.
it definitely helps with anxiety. I had
Yes.
a lady, she came in high strung, and literally I put 4 needles in the top of her head. I told her I'll be right back. Came back with literally within about a minute, started talking to her. You could see her complexion started to come back. And I'm
Hmm.
laughing to myself thinking, this is pretty neat. So I actually said, how are you feeling right now? She says, I don't know what you did, but this acupuncture is definitely doing it. It's helping me calm down.
Hmm.
So I like that. But then really it's a team approach. You got to use bits and pieces of everybody to come together to treat that one person. It just like raising kids, it takes a village. It's not only one section does it; a whole group will help treat the overall condition.
Yeah.
I agree. I
I,
love acupuncture.
one thing I like, Dr. Corey, you say healing is not linear. I've
Yeah.
never thought of it like that, which makes sense because you think of it, and we never actually focus on the ups and downs. When we think healing, we like you go from point A to point B, and it's a straight thing, but it's not. You have all of these nooks, cranny turns, and everything. So I do like how you actually said that healing is not linear. It's a good one because I
Hmm.
didn't think about it. That's actually
Yeah.
good.
You know, I'm a nerd like that. If it comes from you guys, you know. Um, how I got that though. I don't know if you've ever heard of this physics. There's a physics term, or there's this thing called the brachista. I can't even say it right. Brachistochrome curve. Brachistochrome curve. And if you look that up, I'll put it in the chat there. But it's basically talking about how if you look at these, well, let me not explain it. I'm gonna let you go look at it. How about that? That's your homework assignment. Is histochrome curve, but it's basically looking at linear. Like a lot of times we think that the quickest way from 2 points is a straight line, right? We learned that a little bit, or we think that from getting from point A to point B, the quickest way to
That
get from
was math.
point A is a straight line, and in
Hmm.
reality, it's not always that way. Sometimes we have to make detours to get there.
Hmm.
There you go. The-
Hey,
And
never heard of that, but
yeah,
Brother
man.
Wikipedia.
So go on YouTube.
Yeah, YouTube is the teacher.
Yeah, YouTube is a teacher. So basically, if you look at this, we think that the shortest line from a point A to point B is a straight line, when in actuality, it's not always. And so there's these balls at the top of this on the top left hand corner that they're going down either a straight line or a curved line to get to the end.
Mm-hmm.
And surprisingly, the ones that are curved get to the end line the fastest. So you can see how they all start at the same time, but the one in the red line actually meets the end faster than the one that was going down
Great.
the straight line.
Mm-hmm.
And what that tells me is that, you know, a lot of times if you look at that red line is going underneath the surface. It's digging deeper into the issue. And then you use momentum as well. And believe it or not, you know, it just whips right into the end. And I look at that as the healing process. You know, if you until you really get down to the real root of it,
Exactly.
you know, you're really not leveraging your full potential. You're really not addressing those things. So when it even comes down to mental health, um, you know, there's a lot of underlying stuff going on, and
Mhm.
a lot of stuff we don't even want to talk about, but it
Exactly.
is actually hurting us. And I like to also get another plug is there's a book called The Deepest Well. I don't know if you've seen this, Catherine.
I've never seen that one.
So there's a book called The Deepest Well, and I just started
Let me
reading
put that
this,
down.
by the way. The Deepest Well is by Dr. Nadine Burke Harris, and you know, really profound book. And I actually was I was somebody gave this to me to read it because um it really talks about the healing the long-term effects of childhood trauma and adversity. And it really reinforced, like the introduction really talks about how um a lot of times we just think that um you know that a heart attack or a stroke should even come with a lab or a symptom. And a lot of times it doesn't.
Mm.
That we can see with the naked eye, right? And it talks about, in the introduction, it talks about how, you know, a heart attack and stroke was basically missed because they didn't look at a lot of things that were going on in that person's childhood that they were carrying for years and years and years and years, that they never really
Exactly.
addressed it. So those same cortisol levels and those underlying tests, they can reveal some things, but
Mm-hmm.
it's amazing as you go through. And I see this day in and day out with my practice is once you start really going deeper into it and
Mm-hmm.
having them have a safe place, having them have a place where they can really feel comfortable to
Open
talk
up.
about those
Exactly.
things. It's amazing how that just like that, you know, that curve, it just whips them into a better place of healing. But it's a work.
Okay.
It's work though.
Yeah, you're right. The safe place. Um, if someone doesn't have that, they're not going to disclose it. Um, and you speak about like a lot of the issues patients can have. You're running all these tests. None of the tests show it. The best example that I can kind of share is post-traumatic stress disorder from sexual abuse.
Mm,
I've had 3 of those cases this week. Um, and these individuals, it was men and women, who had anxiety levels through the roof, um, as well as depression levels through the roof. And the medications were not working. And it was because they were not addressing that one issue. So that one issue that happened many years ago that they had from like 6 years old, 7 years old, so on and so forth. One was 4 years old that they could remember. They're holding on to that. They're suppressing it. So just think about all of those years that they had to suppress this because they don't want to talk about it or feel ashamed about it, so they keep it deep down inside, and then they may have one little issue that will trigger, so that's that trigger word, cause them to have some type of issue, and then boom, their cortisol levels are through the roof, Then next thing you know, their thyroid is off, and then their high blood pressure, well, their
Oh no.
She was on a good point.
And she was actually a good part, then it froze up.
Yeah.
There
They
she
can't.
goes.
They can't silence you, Catherine. They can't silence you. Go ahead, say it, because you got cut off a little bit.
Okay. Are you there?
Yeah, we're here. We hear you. So you were
Okay.
mentioning like the thyroid and all those things.
Yeah. So all of your levels start being out of whack, and you're wondering why none of your medications will not work. Why they aren't effective, and they aren't effective because you're suppressing that that brick of stress. And if you open up, and people aren't going to necessarily open up just to say, hey, I was molested at 5, let me tell you all about it. That's something that it take a lot of courage, it take a lot of strength. A lot of times patients feel embarrassed, like they deserve to have it happen to them, so they withhold that information and just keep it deep down inside. But again, if you build that rapport with that patient and let them know, you can be a professional, you can have Dr. So and so, but what they need right then and there is that person to make them feel heard and seen. You can speak all of the high-tech lingo and be all, gifted and smart. They don't want to hear that. They want you to keep it real with them and speak like, it's not like you're saying dumb it down, but sometimes you do. And when you kind of put it to their level to help them understand, they will also feel like, oh, I can share, I can relate to you, or you can relate to me. And you can still be well spoken, but sometimes people just need to feel that. So if they don't feel it, they're not going to disclose it, and all of your labs are still going to be high. And there you go, treating the patient the next week and the next week. So that's why they do RCAs. What is the root cause analysis? Because how do we get here?
Right.
Dr. Whiteside, my bad. Whiteside. Dr. Whiteside. Colonel. Is there anything you want to add? Yeah, you muted anyway. Is there anything else you want to add to that?
No, that's it. Sums it up. I appreciate it. Good talk. Shoot, Kathy, know her stuff. I love it. Go on, sis.
No, I'm reading off this prompt on ChatGPT. Thank you. No, I'm kidding.
I thought you was calling me out. I said, that's what I do.
Listen, if I need a little assistance, hey, ChatGPT, help me, girl. Listen, honestly, so there's an article about that, about people using ChatGPT to cheat. It's not cheating. It is another resource. Okay, you just have to know how to utilize it appropriately. And if you actually quote it and put it down, appropriately according to the APA format, then it's not cheating. You just had another helper.
Using your resources. I'm with you.
That's right. Yeah.
Dr. Whiteside, you want to take us out? It's 13 minutes after the hour.
All right. I appreciate everyone joining us on the live. I really do. Sorry about the delay at the beginning. My brother was trying to talk me into how to operate this thing. Just like a true doctor, I just want to show up and disappear. All the behind the scenes stuff. Nah, he runs behind the scenes. So I apologize about the delay. That's all. I had to take the blame on that one. No, great talk. I do appreciate it. Appreciate everybody joining us. And I'm thankful for it.
All right. Anybody from the chat? Did y'all want to chime in on anything? Other than that, we're ended. Dr. Kathy, anything you want to talk about? Say final thoughts, comments?
I would like to thank everyone for attending and actually asking questions. So With that being said, if there's anything that you would like to discuss on the next session, that would be helpful. And I can, try to come as prepared as I can. But anything that I can help with, I'm definitely here to help.
Dr. Coy?
Dr. Coy Abraham, Coy Wellness Solutions. You can reach me at www.coywellnesssolutions.com, Instagram, Facebook. I really appreciate those folks that are on really talk about this topic. It is a topic that lots of times we like to push off and not take the courage to look at. But when it comes down to health, we have that mental health, we have the spiritual health, but we also have our physical health, and all of them work together. So, making sure we don't push that mental health aside and addressing those the best way possible, whether it's with professional or just talking about those issues and putting them in the forefront, I think is very, very important. So when it comes down to health issues and reversing type 2 diabetes, hypothyroidism, and other autoimmune conditions, we're a holistic approach to help them with that, but also we help companies as well to get them out of a bind with unhealthy employees as well. So we come into the company and help CEOs and entrepreneurs to help their employees to get healthier as well. So from all encompassing. So it's mental health as well as the physical health.
Right. And look, they got the doctors. I'm just a YouTube person, so I ain't got nothing to say. I'm mind my business to stay in my little place. Other than that, y'all, thank y'all so much for coming out. It's 16 after hour. We'll see y'all next time. Have a good one.
See you later. Go Commanders.